When you think of arthritis, what's the first thing that comes to mind? For most people, it's joint pain. But what if I told you that arthritis often whispers before it roars? Many of its earliest and most telling symptoms are subtle, easy to dismiss, and have nothing to do with aching knees or stiff knuckles. Understanding these hidden signs is the first step toward getting the right diagnosis and treatment, which can make all the difference in managing the condition and maintaining your quality of life. So, let's look beyond the obvious and uncover the surprising symptoms of arthritis you might be overlooking. One of the most common yet frequently ignored signs of inflammatory arthritis is profound fatigue. This isn't just about feeling a little tired after a long day. It's a deep, persistent exhaustion that doesn't improve with rest. Your body is in a constant state of low-grade battle as the immune system mistakenly attacks your own tissues. This chronic inflammation consumes a tremendous amount of energy, leaving you feeling drained, unmotivated, and mentally foggy. If you find yourself constantly battling fatigue that interferes with your daily activities, it might be more than just stress or lack of sleep. Another classic indicator is morning stiffness that just won't quit. It's normal for anyone to feel a bit stiff upon waking, but if that stiffness lasts for more than 30 minutes, it's a red flag. People with inflammatory arthritis often describe feeling like the Tin Man in the morning, finding it difficult to bend their fingers, make a fist, or even get out of bed comfortably. This prolonged stiffness is caused by fluid buildup in the joints overnight due to inflammation. As you start to move around, the fluid begins to circulate, and the stiffness gradually eases, but its duration in the morning is a key diagnostic clue. Arthritis doesn't always confine its pain to one or two specific joints. Sometimes it presents as generalized aches and pains that feel more like the flu or a tough workout. You might experience discomfort in your back, shoulders, or neck and mistake it for simple muscle soreness. This systemic pain occurs because the inflammation isn't just localized, it's a body-wide process. Similarly, you might notice subtle swelling or tenderness in certain areas, like your finger or toe joints. The joint might feel warm to the touch or look slightly puffy, even if the pain isn't severe. These are early signs of an active inflammatory response. The systemic nature of some types of arthritis means it can cause symptoms you'd never associate with a joint condition. Unexplained low-grade fevers, unintentional weight loss, or persistent flu-like symptoms can all be driven by the body's inflammatory response. The same immune system confusion that targets your joints can also affect other systems. For instance, certain forms of arthritis, like psoriatic arthritis, can manifest on your skin. You might notice scaly red patches, psoriasis, or changes in your fingernails and toenails, such as pitting or discoloration. These skin-related issues can appear years before any joint pain begins, serving as an early warning. Even your eyes can be affected. Some autoimmune conditions linked to arthritis, such as ankylosing spondylitis, can cause a painful condition called uveitis, which is inflammation of the middle layer of the eye. Symptoms include eye redness, pain, blurred vision, and a significant sensitivity to light. If you experience these eye symptoms, especially if they are recurrent, it's essential to mention them to your doctor, as they could be connected to an underlying inflammatory disease. Recognizing these diverse and seemingly unrelated symptoms is crucial for putting the pieces of the puzzle together. If any of these hidden symptoms, prolonged fatigue, significant morning stiffness, generalized aches, or issues with your skin and eyes, sound familiar, it's time to seek medical advice. Don't dismiss them as just signs of aging or stress. An early and accurate diagnosis is the most powerful tool you have. It opens the door to effective treatments that can control inflammation, prevent joint damage, and help you manage your symptoms. Living a full and active life with arthritis is entirely possible. It starts with awareness and proactive care. By learning to listen to your body and recognize even the subtlest signs, you empower yourself to take control of your health. With the right support and management plan, you can continue to enjoy the activities you love, focusing not on your limitations, but on your possibilities. The journey to wellness begins with understanding, and now you are one step closer.